The real fight over healthcare isn't just about policy. It's about whether healthcare in the United States should be treated as a basic human right or a market product. And this is where the clash between Medicare for All supporters and President Trump's evolving healthcare ideas becomes impossible to ignore. Trump's delayed plan and rising anxiety. As President Donald Trump repeatedly delays revealing his long-promised strategy to rein in America's soaring healthcare costs, supporters of Medicare for All are seizing the moment to push for a completely different direction. They argue that instead of tinkering with complicated subsidies and patchwork fixes, the country should move to a single-payer system where the government guarantees coverage for everyone. But here's where it gets controversial. While Trump's team appears to be focused on reshaping the existing Affordable Care Act, ACA, framework, Medicare for All advocates say that approach will always leave people behind. A recent national poll from West Health and Gallup shows just how tense things have become. Nearly half of U.S. adults, 47%, say they're worried they won't be able to afford health care in the coming year, the highest level recorded since this tracking began in 2021. That means millions of people are living with a constant, background fear that a single illness or injury could destroy their finances. Even if healthcare prices stayed flat, which they aren't, rising costs for housing, food, and other essentials are making it even harder for families to absorb medical bills, pushing more people to delay or skip care altogether. Healthcare is a human right. The moral argument. Medicare for All supporters frame this debate not just as a technical policy issue, but as a question of values. Senator Bernie Sanders has slammed Republicans for coming up with endless healthcare ideas that avoid the one step he considers most important: recognizing healthcare as a fundamental human right that must be guaranteed to everyone, regardless of income, job status, or health history. And this is the part most people miss. Once you accept healthcare as a right, it changes what kinds of compromises you're willing to tolerate. National Nurses United, the largest union of registered nurses in the U.S., has echoed this call, arguing that the level of fear and financial strain revealed in recent polling is simply unacceptable in a rich country. For nurses on the front lines, the current system doesn't just create paperwork headaches. It forces impossible choices when patients can't afford the care they need. Supporters say a single-payer system like Medicare for All would simplify coverage, cut out much of the private insurance bureaucracy, and allow people to see a doctor without worrying about surprise bills. Senate maneuvers and the ACA timeline trap. Meanwhile, recent moves in Congress have exposed deep divisions within the Democratic Party itself. Earlier this month, despite objections from progressives including Sanders, a small group of Senate Democrats agreed to help Republicans end the longest government shutdown in U.S. history. In exchange, they didn't secure a major structural change, only a promise to hold a vote in mid-December on extending enhanced ACA subsidies that help keep premiums in check for more than 20 million people facing sharp increases. Supporters of that deal say it was a necessary step to protect millions from huge premium spikes and to get the government running again. Critics respond that Democrats essentially traded away leverage for a non-binding promise and still left healthcare subsidies on a political timer, vulnerable to future brinkmanship. This raises a tough question. Should Democrats keep pouring energy into shoring up the ACA's patchwork system? Or is it time to demand deeper reforms like Medicare for All instead of short-term fixes? What Trump's healthcare concept was reported to include. Leaked descriptions of Trump's anticipated proposal suggested he was preparing something called the Healthcare Price Cuts Act, aimed at dealing with what allies described as surprise premium hikes. According to those reports, one core idea was to end so-called zero-premium ACA plans, policies where low-income enrollees pay no monthly premium after subsidies, on the grounds that they supposedly enable ghost beneficiaries, or people allegedly receiving coverage fraudulently. Instead, every enrollee would have to pay at least a small amount out of pocket, framed as a way to verify eligibility and ensure people are truly engaged in the system. Another component reportedly under consideration was a deposit or incentive program to nudge people toward cheaper, lower premium plans on the ACA marketplace. If someone downgraded to a less comprehensive plan, part of the savings would be funneled into a health savings account, HSA, funded by taxpayer dollars, which the enrollee could then use for medical expenses. On paper, this sounds like a way to reward cost-conscious choices. but critics argue that it effectively encourages people to accept skimpier coverage and more financial risk in exchange for modest HSA deposits. GOP pushback and the plan in limbo. Here's an unexpected twist. Even many Republicans reportedly balked at Trump's draft plan once they learned some of the details. Some GOP lawmakers were caught off guard and worried about whether the proposal would include additional abortion-related restrictions, as well as how it would play politically to change ACA subsidies while premiums are already high. As internal resistance grew, the rollout of Trump's plan stalled, leaving the public with only fragments and leaks instead of a clear, fully explained proposal. Progressive analysts have warned that Democrats may feel compelled to accept some version of Trump's framework, or a similar offer, if it is seen as the only path to prevent huge premium hikes for millions of middle-class enrollees. Their concern is that Republicans are willing to tolerate, or even engineer, a crisis in premiums as long as they can attach conditions that weaken coverage, shift more costs onto lower-income people, or further privatize the system. This is where the controversy sharpens. Is it better to accept a flawed deal that limits immediate damage, or to reject it and risk being blamed for rising premiums while holding out for a stronger, more universal solution? Sanders, Broader Healthcare Agenda. Sanders has used the current moment to lay out a broader, multi-part plan he believes Democrats should rally around, even if Medicare for All itself does not yet have majority support in the party's congressional caucus. He argues that now, with Republicans forced to at least acknowledge that the U.S. healthcare system is in crisis, Democrats must unite behind practical steps that make healthcare more affordable and accessible in the short term while still pointing toward a more transformative long-term vision. Among his priorities: extend and solidify ACA tax credits so people do not face sudden, massive spikes in premiums. Reverse roughly $1 trillion in cuts that Trump and congressional Republicans previously made to the ACA and Medicaid, which reduced support for lower-income and vulnerable populations. Expand traditional Medicare to cover dental, vision, and hearing services, 3 areas that regularly impose heavy costs on seniors and disabled people, despite being essential to quality of life. Slash prescription drug prices by requiring pharmaceutical companies to charge no more in the U.S. than they do in other wealthy countries like those in Europe or in Canada. Invest more in primary care so people can get early, preventative treatment rather than waiting until conditions become emergencies. Ban stock buybacks and dividends in the healthcare sector, and place tighter limits on CEO pay to discourage profiteering in a system that deals with life and death needs. Medicare for All as the endgame vision. Even as he pushes these incremental reforms, Sanders has been clear that he still sees Medicare for All as the best long-term solution. As the top Democrat on the Senate Committee on Health, Education, Labor and Pensions, he reintroduced the Medicare for All Act in April alongside Representatives Pramila Jayapal and Debbie Dingell. The bill envisions a single, national public insurance program that would cover everyone and replace most private health insurance. Supporters argue that this would dramatically simplify the system, reduce administrative waste, and remove the constant fear of losing coverage because of a job change, a move, or a gap in employment. They emphasize that under such a system, care would be based on medical need rather than on the fine print of an insurance contract. Opponents counter that such a plan would be too costly, too disruptive to existing employer-based coverage, and too heavy a role for the federal government. One of the biggest points of ideological conflict in U.S. politics today. Progressive voices seizing the moment. Other advocates of single-payer healthcare see the current debate as a rare opening. Some progressive commentators argue that Republicans, by loudly criticizing the greed, corruption, and inefficiency of the current healthcare industry, even if for their own reasons, are unintentionally helping shift public opinion. When Republicans attack insurance companies for profiteering or waste, it becomes harder to defend a system that relies heavily on those same insurers. From this perspective, Democrats have an opportunity to do more than simply defend the ACA's status quo. Instead of merely promising to fix the existing system, they could make the case for moving beyond it, toward a model where coverage is automatic and universal, and where private insurers play a much smaller role. Supporters say that clinging to minor ACA adjustments, while Republicans propose half measures and cuts, risks leaving the public stuck between two unsatisfying options, and missing the chance for a deeper overhaul.